First of all, I'd like to thank you for the opportunity to be here with Jitema and all of you. My name is Luciana Malu from Brazil, São Paulo, and it's such an honor to be part of this team. And today I brought a case to discuss how to customize facial rejuvenation with fillers, threads, or both. So, Dr. Sandran have already told a little bit about myself. And just so you know, I was on a 6-month fellowship in Washington, D.C., next to you, Dr. Sandran, and doing cosmetics in ethnic skins. I'm half Lebanese, half Italian. And I have a hands-on workshop in my clinic for doctors and to teach how to combine these procedures. So when we see this 44-year-old female patient, what catches your eyes? The moderate laxity and ptosis of global face, the prominent folds and the loss of the mandible contour, and the involuntary contraction of the mentalis muscle to maintain the lips closed. And in this slide, we can see better the global ptosis and sagginess of face and neck, and more than this, her retrognathism and the very disproportional relationship between her nose, lips, and chin. But she came to see me complaining about just and only her big nose and asking me to soften the nasal dorsum, but not straighten it 100%, because she would like to keep it as it is, but smoother. Well, as a doctor, I had to explain to her that even though all she could see was her nose, she needs to understand the reasons for that. All the assessment and the 4D process of aging, skin, fat pads, muscles, retaining ligaments, bone, and the global appearance, everything is connected, has a context. And why she's here into the moderate laxity in the lower, upper, and middle face. Moving on, in practice, Ricketts line is for lip projection, and the subnasal line is for chin projection. And besides that, she has a retrognathism class 2, and she should see an orthodontist before the cosmetic treatment. But she didn't want it. So I proposed to soften this very disproportional relationship. So these are my previous marks on her just before the procedures. I outlined the mandible body and clinically the jaw. I started with 12 barber threads, 4 on the mid-lower face in this diagonal here, where the sum of the aging vector force acts or works. As we can see, all the face and neck were cleaned with antiseptic solution, and only sterile supplies were used: surgical fields, gloves, gauze, and 4 more threads on the submandibular area, 2 on each side, entering through the same puncture from the lateral to the medial. So here we can see the left side done. Look at the soft tissue repositioning. Here. And as we can see, I could treat the ptosis and the laxity with the threads. Although her retrognathism, her mental contraction, and her nose weren't treated, even improved, Then, from this point, I started with fillers, but with the least amount of products. As you can see, each product has its own place. Most of the time, we have to combine procedures. And in this case, with the fillers, I could design some specific details. Then, in the same session, I started with Eptic S500 in bolus on the supraperiosteal layer to project the chin and to fill the canine or piriform fossas with needle, and the rest with cannula into the subcutaneous layer. And the total of syringes was 3. In addition, I inserted Eptic S300 supraperiosteal into the malar area, below the orbicularis retaining ligament and the zygomatic cutaneous ligament with cannula, and the rest was into the subcutaneous layer with cannula as well. And the total of syringes were 3. So this slide is the summary of this first treatment with all the products used. And these are the preliminary outcomes. And 30 days post-treatment, the touch-ups. In our second meeting, I only added Eptic fillers. At this moment, I inject some drops of Eptic S300 into the supratip breakpoint onto supraperichondral layer and supraperiosteal layer into the radix, trying to maintain the rhinon, but smoother. This session was just to fine-tune my treatment. The total of syringes used was 1 more Eptic S500 and 2 more Eptic S300. So these are the total amount of products in the whole treatment. And these are the final outcomes. 30 days later, here, immediately post-treatment. And here, I'd like to draw your attention to the improvement of her chin, the symmetry, and I can tell you the myomodulation that the ventral muscle could achieve. And this is an overview to see all the improvements, a very natural rejuvenation without losing her traits and peculiarities. Well, I think I could deliver her a softer nose and a better proportional relationship between her nose, lips, and chin. And it's here, it's a 2-month picture post-treatment. It seems she has slimmed down and she looks younger. And I asked her if she liked it. She was very happy, pointing her nose. So in the end, I think I got it. And the most important thing is she is happy and loving herself. So to conclude, it's clear to me that we have many tools in our hands to deliver a very natural beauty cosmetology by combining treatments. And we not only have to pay attention to the patient issues, but also to guide them, to talk to them, and to explain to each and every patient what we are planning to do before starting the procedures. Assessment is a medical act, and it's part of my routine every day. And in this case, she came to see me asking for a better nose, and I could deliver her a better face, trying to maintain her identity, but giving her a natural global youth, combining treatments in order to use the least amount of products. This is nowadays the Brazilian cosmetic tendency, combining procedures and not use too much, only one product. And here I'm doing one of my hands-on workshops for medical doctors in my clinic. I'd like to thank you very much. I hope you enjoy the case. I feel fulfilled to being able to share a little of my aesthetic practice with all of the world. And I think globalizing knowledge, experience, and learnings is the most powerful wisdom. And it was a very nice meeting all of you. Thank you.